As Washington tangles over health insurance, many Americans are taking matters into their own hands.
I wanted something that wasn't going to be the same sort of trap that I had been in.
Attorney Steven Stroh-Snyder and his wife Jennifer have 3 young boys and a baby on the way. 2 years ago, they paid $500 a month for insurance. The premium's been steadily rising, and this year would have hit $1,500 a month, a 52% jump from where it started.
We try to find the best deals that we can, and even the best deals that we could find were going up and up. And according to our insurance broker, it was just everybody's was going up because of Obamacare. And we could choose a different provider, but the difference may be $10 or $15 a month. There wasn't going to be a huge savings, whichever insurance company we went with.
So Steven and his family took a leap of faith by approaching healthcare in a more biblical way, a Christian health share.
Your brothers and sisters in Christ have committed themselves as being part of this family that loves you enough to say, I'm going to help you out when your burden exceeds your ability to bear it.
There are a number of Christian health sharing ministries, including Samaritan Ministries, Christian Healthcare Ministries, and Liberty Health Share. The Stroh-Snyders chose medi-share. Unlike traditional insurance companies, a health share collects monthly dues and then distributes the money to members who have medical bills that exceed an annual amount that they've chosen to be responsible for.
We've selected for our family to have our own household responsibility of $5,000 a year. So we know that out of our own pockets, we're going to be responsible for $5,000 worth of health care cost, and that's just our own responsibility that we'll take charge of.
If medical needs exceed that amount in a given year, they notify their health share and receive a check to pay their health care providers.
I'm responsible for it, but my fellow members are making a commitment that they're going to help me meet those responsibilities that exceed $5,000.
The Stroh-Snyders feel that being a part of a Christian health share allows them to take some of the teachings that they've heard about in church and read about in the Bible and live them out.
We can see a picture of the church in Acts 2, where the church shares everything in common, and the believers, they share their possessions and make sure that everybody is taken care of, and that when there's a need, you meet it. And we're also told to be responsible for our households. And so what I see is Christian health share helps you do both of those things.
The Stroh-Snyders say 2 things really stand out to them about being a part of this ministry. First, they've received prayer when they call to ask a question or get more information about their coverage.
It was really uplifting and encouraging, and not a moment that you would ever associate with healthcare or insurance, or at least I wouldn't have.
And second, each month they receive an email about families being helped by their share, encouraging a note or prayer on the family's behalf.
Every time I do that, it helps me have the confidence and understanding that in my hour of need, when our family may need it, there are going to be other people out there that want to do the same thing.
Since these are Christian health share ministries, there are limitations. Members agree to abide by a Christian lifestyle. Failure to do so could lead to uncovered medical costs. For example, if you were involved in a car accident after drinking, you'd be required to pay your own health bills. Becoming pregnant out of wedlock would also not be covered. Steven believes his family would stay with their program even if Washington succeeds in overhauling healthcare with lower premiums and better coverage.
I feel that there is a way that I'm contributing to the family of Christ that I'm doing now that I can't do through traditional insurance. And so I don't want to go back into a method that ignores the needs of my brothers and sisters.
Caitlin Burke, CBN News, Waynesboro, Virginia.
It's better just to answer his question without a